Welcome back. We are going to continue with our discussion of the head and talk about the jaw now. So, with jaw, there can be a lot of different issues with it. Sometimes people have pure pain at the joints of the jaw. Sometimes people have a clicking or some type of catching when they open and close their mouth. And you can even see a deviation of their jaw, and they've been diagnosed with some type of TMJ disorder or dysfunction, something to do with their joint right here. There are many treatment options for this type of disorder depending on what is the underlying issue going on. Some people will wear night guards. Some people actually have surgeries. Some people are sent to physical therapy. There are many options out there. I have worked with people of all different levels of TMJ disorders, and a lot of times it is a misbalance or imbalance of their muscles in their jaw and their neck. They may not even realize that they're clenching throughout the day or even at night when they sleep. It's harder to correct at night when you're sleeping, so a lot of times people get a night guard. I wore one for 9 years, and when I started learning about breathing and how I can change the way my muscles tighten up, I got rid of that night guard cold turkey, and it has worked for me to relax everything so I don't clench and need that night guard at night, because I found that I was getting headaches and having issues from the night guard. Sometimes they work for people, and it worked for me for many years, but then I found it wasn't necessary if I could calm down my nervous system. So what happens with TMJ is that certain muscles inside our mouth, our pterygoids, or even our masseters out here, can get abnormally toned or contracted. The nervous system ramps up and these muscles tighten, and sometimes if we're doing some type of activity, we clench our jaw to help recruit muscle activity in the rest of our body. The problem with that is if we don't practice relaxation and make that purposeful, those muscles become so tight and we don't know how to let them go. When this happens, you start to get a mismatch of where the joint should be when you start to open your mouth to eat or swallow. That then leads to problems down the line when there's a disc in there and a ball joint, and if that's not aligned properly, that disc can get caught and then you get a clicking sound. So what we want to think about is during our daytime, having your tongue to the roof of your mouth just behind your teeth and have it just resting there gently so it creates space between your teeth when you're relaxed. So if I'm sitting here, you can't even tell that I have space in between my teeth. Now, if you catch yourself clenching, this is a good tool. But sometimes you need a little bit more than just relaxing. There are muscles right here along your jaw and right underneath that can get very tight. So gentle, very, very, very gentle massages can help that, but also practicing some of the breathing exercises I teach, in addition to gentle pressure to help cue those muscles to relax, can be very relieving to a lot of jaw pain. I typically like to go over that in person with someone or through a virtual session to give more instructions on it. So if you want that, you're more than welcome to contact me about that. But if you already have a practitioner who knows about jaw pain, you might be able to see them as well to have them teach you some of the massage techniques on your jaw. The key is to letting the muscles go, and then also looking at your upper body positioning of your trunk, your rib cage, and your neck. If you're very prominent in your chest and your head goes forward, it's going to create stress in your jaw. So working on getting your sternum down and your head into a neutral position can help quite a bit with your jaw. If you have further questions, please let me know. Thanks again for watching. We'll see you next week. Bye.